growing frustrations.
I feel ripped off. I feel cheated.
I'm hopeful that the government will listen.
If somebody doesn't get the help they need, what could happen?
Mission Memorial Hospital has faced 6 overnight ER closures this year so far. Now, calls are growing for urgent and stable solutions.
I'm saying to the government, come on, get your act together. Come on, do something that the people in this community actually feel the change.
Abbotsford Mission MLA Rianne Gasper led this rally, urging health officials for better transparency and solutions on the issue.
Mission matters, and we are not going to be forgotten, and we're not going to be pushed aside.
The hospital's medical director, Dr. Paul Theron, says there are a number of ongoing factors that are leading to the closures here. A key challenge is the actual physical state of the emergency room here. He says back in January 2024, there was unexpected flooding throughout much of the department. That meant that the ER had to be moved to a temporary location, and that continues to this day.
That led to an exodus of some of our permanent physician staff at the time who felt that they weren't practicing in a safe environment.
He says renovations could take about 18 months, but the ER will be expanding from 27 care spaces to 41. But as the city grows, he says a shortage of physicians continues to weigh on the hospital.
Mission should have 4 to 5 physicians per 24 hours in our ER. Currently, we're doing rounding 1 physician per shift, 3 physicians per day.
Dr. Theron says there are 2 new doctors being recruited from the UK, but they are tied up in the immigration process. Mission Mayor Paul Horn acknowledges the worries of residents. He says the temporary closures reflect a broader struggle across BC.
We're having difficulty in communities of our size attracting and retaining doctors.
In Delta, there have been 4 overnight ER closures this year, and the problem is even more persistent in the northern and interior health regions. Mayor Horn says the city is working on solutions to retain doctors, such as building 13 units of healthcare worker housing beside the hospital, and plans for a health and wellness district surrounding Mission Memorial.
So that around the area, doctors have places where they can live, where they can refer patients for outpatient care and diagnostics.
Both Fraser Health and BC's Ministry of Health stress that recruitment is a priority. The province says between May and June 2025, Fraser Health received 154 applications from qualified healthcare professionals in the U.S. The ministry notes other initiatives include fast-tracking credential recognition, expanding the UBC Medical School, and establishing a new medical school in Surrey. But despite the promises, residents here are still left wondering if they will get emergency care when they need it most. Baneet Braich, CBC News, Mission.